Thank you so much, Aina Sharma, for joining RESO and this platform and giving your precious time. And we highly appreciate your time and your professional dexterity. So, this is a interview possibility where we just seek expansion and possibility for research and academic activities and pursuits. So, once again, I just really thank you on this platform. And my first question to you is just give your introduction and tell us a bit about your work.
Okay. So, hi, my name is Dr. Aina Sharma, and so I have recently completed my post graduation in Masters of Public Health from a very reputed institute of India, that is PGI MAT Chandigarh. My background is in dentistry. I have also worked for a few months into pharmacovigilance that deals with adverse drug reactions. Um, so during the course of MPH, I have learned about various aspects of healthcare, including nutrition, environment, health economics, maternal health. So we have almost covered every aspect of health. Um, if I talk about my research interests, so I hold expertise in conducting systematic reviews and meta-analysis. Um, and I can say that I have almost 6 to 7 years of experience in this healthcare sector. So that's about it.
Well said, Dr. Ainaji. And it's really important to learn about your research interest and so that our audience can also draw benefits. What kind of personality you are, your perceptions, your thought process, and particularly your research work. It is important for us to know. Now, I just would like to move on to my second question. It's an important question because we all struggle in terms of public health, specifically in Indian context, and it's is the COVID 19 vaccine a trigger for increasing heart attack cases in India?
As I would not like to believe that, because we don't have any evidence till now regarding this thing, and clinically also it's not proven till now. And I choose to believe that the vaccination, the clinic, it has undergone proper clinical trials under the scrutiny of government, and then it was delivered to the community. So I think I choose to believe that it was not so. Also, if we look at the various, factors which are responsible for these diseases, so we see that the sedentary lifestyle, which was even very much felt during, the COVID, during the lockdown, which happened in India and in other nations also. So, sedentary lifestyle and the kind of food we take in today's era. So I think all these factors, also lack of physical exercise, obesity is increasing. So I think all these factors have together, caused these diseases to increase. And we recently we had certain issues regarding some claims of some companies. There were issues that the company claimed that certain side effects could happen due to this vaccine, but I chose to believe that uh, until we have some evidence regarding this, so we cannot say like that. So yeah.
Important for us to understand because we see in media, sometimes in social media also, that COVID 19 vaccine is one of the trigger for increasing number of heart attacks in our context, specifically Indian, but there has to be scientific verification and kind of validation
Yeah.
by experts, and you're one of such expert, and we are such it's such a blessing for us to have people like you so that we can really have an expansion of scientific body of data, be it any domain, be it any area. It may be medical science, it may be social science, it may be some sort of different things which are connected to our society. Thanks a lot for your response. And now I just would like to move on to my third question. It says like, share your thoughts on global climate change and its impact. I repeat, share your thoughts on global climate change and its impact. You know how important it is that we've been struggling global climate change and how to handle and how to cope. Just respond to this particular question. It's an important question, ma'am.
So when you're talking about global climate change, obviously this is a very hot and very trending topic. So we all are, I think, experiencing its side effects of this global climate health, and it is one of the chief topics as we know that COP meetings, they are happening. There is Paris Agreement which is happening on this. So if I go back to the causes, what led to all this? So I could think of causes like urbanization is there, the industrialization is there, deforestation, and all these factors have led to increase in emissions of greenhouse gases, which has ultimately led to global warming and changing climatic conditions. Talking about the effects, so impact of this, global climate change is huge. So recently, I was going through an article, and it said that in this 5 months of 2024, 60 deaths have already happened due to heat waves. So that is a huge data in a country where no deaths would occur due to heat waves. So I think that is that's how large the impact of this global climate change is. Also, when we talk about global climate change and global warming on a large scale, so we are talking about melting of ice, and we are talking about melting of glaciers and increase in sea levels, and ultimately the people who are living residing, or the countries which are situated near the coasts, they are in huge danger. And also we are, I think, heading towards being under some natural disaster, because there are cyclones happening, there are drought conditions which are happening, and ultimately it will finally impact the way of living, or the economy of the country, or the nutrition that would be provided to people. So that is there. Also, we are seeing extreme weather events are there. And in a country like India, where like the agriculture is totally rain fed, in most of the states it is rain fed, and so changing climate pattern is also affecting that. And agriculture is one of the primary chief thing that constitutes to the economy of the country, and that is getting affected. Also, if I talk about increasing carbon dioxide levels, so we also talk about ocean acidification. So we talk about how these coral reefs, and all the marine animals, they are also getting affected. So and also we have biodiversity laws. So we are, so basically, due to this changing climate conditions, what is happening is we are destroying the ecosystems are getting destroyed. We are generally recently in a state in India, that is Himachal Pradesh only, there was a lot of rainfall, and there was due to this rainfall the infrastructure was also affected. And so that is, so basically the capital expenditure which we have spent, so that is going to a waste due to all these conditions. So you see how not only human life is affected, but also economy of the state is affected, and all the people lifestyle and everything is affected. So I think that's huge how this global climate threat, this thing is, and how I think cooperation at all levels, at individual level, at societal level, national level, international level, how it is needed, and it is the need of the hour. So yeah.
Thanks a lot. This is such a wonderful section and kind of professional comment, and I would also say like a support by public health, because it's important. We need to also consider deforestation concept, and not exactly a concept but ground reality, social possibility, and a reality. And then urbanization is also there, as you mentioned, greenhouse gases, and these are important areas which have to be captured and looked into consideration. And such a wonderful and professional insight you have provided for our audience. I'm sure we're going to have some massive benefits here by your perceptions and insights. Now I would like to move on to my uh, another question, which says like uh, how do you define public health? How do you define public health in Indian context? It's important for us, specifically for our audience, to know what is public health in our setup, Indian context.
So when we talk about public health, we are talking about prevention of disease, promotion of healthy lifestyle, and improvement of health and healthcare delivery system to the community through organized community efforts, keeping in mind the various cultural aspects of the society. So that's how I would define this public health thing for India in Indian context. And if I talk about various issues that are prevalent, in India, so those are related to communicable disease. We have non-communicable disease. We have increasing cases of hypertension, diabetes, etc., which are increasing at a very alarming rate. So then, besides that, India has recently released its national health policy in 2017, and we have set certain targets. So, in that, we also have targets regarding maternal health, because when we talk about infant mortality rate and maternal mortality rate, so we are, we have set certain targets to. And we intend to achieve those. Also, through national health policy, we talked about universal health care, in which we are talking about more of services that should be provided to the people, more of people that should be covered under these services, and the cost has to be reduced. So a very promising insurance scheme, Ayushman Bharat scheme, have been released by our government, and also we have been trying to increase the healthcare delivery system. So for that, different tertiary care institutes have been established in India, all over the India. And also there are other schemes like Swachh Bharat Abhiyan is there, which focuses on the cleanliness. And there is Jal Jeevan Mission, which intends on providing proper clean drinking water to the people. There is National Urban Livelihood Mission that intends to provide livelihood to the people. So I think also the population explosion, because according to recent reports, India has also surpassed China in terms of population. So how we sustainably move into the future while ensuring judicious use of the resources which are being provided to us, that is very this is a great public health issue now. So yeah, I think that what public health is trending in Indian context.
One of the word I just captured, judicious use of resources or natural resources. It's quite important because we get to hear this word quite a lot in news and news channels and papers and records, and we just take it as a casual and a sort of running talk. But it is important for us and also a responsibility for us as global citizens and citizen of this nation to have a judicial utilization of our resources, such as like water, air, and other possibilities. Well said, a wonderful comment, Indian context, and I'm sure it's again a benefit for our audience and for our platform to expand the very possibility of research and academic activities. And I just would like to move on to my wrap question. It says like, do you see any connection between global climate change and public health? Any connection between global climate change and public health? Please comment.
Um, so obviously there is a huge relation between the ongoing, climatic issue, climatic change, and the public health. As I've already mentioned, that due to heat waves, 60 people have already died in India. So I think that is a huge number, and that shows the direct numbers we have, how both the things are interconnected. Also, if you talk about air pollution, so Delhi, which is the capital, so the air quality is like very worst there, and the people who are residing there, they how much they are affected, and how their lifestyle is affected, how over the years how their respiratory systems would be affected, how their lungs would be affected by this air pollution. So that is a matter of concern. Also in areas like Punjab, so we see smog, and we see burning of these farm products. They burn at the end, and that ultimately causes smoke in the nearby areas like Delhi and all of that. So that also due to which the schools have to be shut down, and students, they also suffer. So you see how all these things are interconnected, how due to these human factors, how even the education of the future generation is affected. Now if I talk about, like I was earlier talking about apple cultivation in Himachal, I think. So now the economy of the state, it is dependent on apple cultivation, but due to this climate change, what is happening, hailstorms come, and heavy rainfalls they occur, due to which this apples, the quality of apple gets degraded. So ultimately it affects the economy, it affects the employment, and it affects the income of the people. So that's how it is making an impact. Also, if I talk about agriculture, because India is mainly, agriculture is practiced here in many states, and it is mainly rain fed. So obviously if the pattern of rain would differ due to these climate change events, so obviously the economy is gonna come down. So ultimately, when we talk about GDP and all these things, so this is ultimately gonna affect, our nation. That is there. Also, due to these, increasing global warming, if we talk, or we talk about, changing climatic conditions, so vector-borne diseases. They will also, the vectors, the population of vectors will increase. Vector-borne diseases would increase a lot, and that is, I think, a grave matter of concern. And so I think, everyone, all of the stakeholders, they need to come together to form, we need to take every measure at individual level. At every level we need to have some proper, we need to realize that the what the future is going to cost us, and we need to take certain solution and certain steps, that should solve this problem, which is to come. And already we are having, so much impact of this climatic change on our lifestyles, on our on our earnings, on our employment issues. So we need to, I think, have cooperation of all the sectors, all the ministries have to come together and find a solution for this thing.